Steve, first off, tell us about this ad in the Sacramento Bee and why it's so important.
When the Desert Healthcare District and Foundation met with us, the conversation was about what we could do together as a community to advocate for more equitable access to prevention and care during this monkeypox outbreak. And I think for anyone working in community health, that part of your role is always advocacy. And oftentimes it's creative and quiet, and sometimes it's creative and it makes a little bit more noise. And so what we're hoping is that this ad, which will run Sunday simultaneously in the Sacramento Bee newspaper and also in the Desert Sun, so community members can see the ad that's placed in another community to advocate on their behalf. It's really just asking the state of California to really reconsider how it's distributing the monkeypox vaccine and to distribute more quantities as soon as possible to our community so that anyone who wants or needs the vaccine can get it.
Are you hopeful that this ad will make a difference?
I think, everybody has the ability to use their voice and advocate. And I think elected officials do listen to their constituencies. I think that this is going to get their attention. Obviously, it's a full page ad in the newspaper that they read. I'm sure they're already thinking about this issue, but we're very hopeful that being reminded that Palm Springs is a community with 32 big events coming up and a large community that needs access to the vaccine, we do hope that this will help them prioritize the community in the distribution process.
You mentioned the 32 events that are going to be happening soon in the desert. Are you concerned that if monkeypox is not addressed soon, this valley will be hit hard?
I think that's everyone's concern. And it's, not just hit hard, but unnecessary suffering. You've talked to some of the individuals who have been diagnosed with monkeypox. So, you've heard firsthand of their unimaginable suffering, and it's not necessary. If we had greater access to the vaccine, if we had it earlier, we could prevent many of the transmissions that have yet to happen. And no doubt, this is transmitting in prolonged skin-to-skin contact. And a lot of these events, whether they be pool parties where people are in very close proximity, or other events that bring people together in very crowded spaces, whether it's dancing or whether it's in a more intimate way, that would put more individuals in our community at risk.
And also there's a demand for TPOXX, the antiviral drug, for folks who already have monkeypox. Are you seeing a request for that as well?
We are absolutely advocating for that. That is, of course, in very tight supply, and it's being allocated as much as it's possible to as many people who need it, but it's not getting to everyone. And so that, again, means that people are suffering unnecessarily. But the distribution process for that is very similar to the vaccine in that it's allocated at a federal and a state level, and oftentimes not considering the unique or disproportionate population of LGBT residents and visitors. Palm Springs gets over 1 million visitors a year that would identify as LGBTQ, and many of them are coming soon for some of these events.
Anything else, Steve, you would like to say about monkeypox or this ad before we let you go?
As we advocate is that we're advocating and we're educating, because while anyone can get the monkeypox vaccine, it is important to remind viewers that it is today transmitted most often in prolonged skin-to-skin contact. And so if you see someone who you think may have monkeypox or may identify as LGBTQ and you're connecting the two for some reason, there is no reason to be unnecessarily afraid or to stigmatize those people, because it is prolonged skin-to-skin contact today and how it's most often transmitted.
You're so right about that. Stephen, as always, we appreciate your time. Thanks for joining.
Thank you.